name is Davide CAPODANNO from the University of Catania. So today I was asked to discuss the topic of duration of dual antiplatelet therapy in view of the latest advancement of coronary stent technologies. So we have basically discussed the different options on the market. Of course, we have better stents with better platforms, polymers, better drugs. And as a matter of fact, the rates of stent thrombosis are decreasing over time. So when we discuss the duration of the DAPT, we should be aware of this new situation and realize that perhaps the duration of the DAPT is not really related to the stent itself, but to the patient as a whole. So what we try to protect when we prolong the DAPT is not just the stent, but the coronary arteries of the patient and new atherothrombotic events that perhaps arise also in a different vessel. So with that in mind, we discuss, of course, the new guidelines on DAPT duration at both sides of the Atlantic Ocean. Now the default duration for a patient with stable coronary artery disease undergoing stenting is 6 months, but there is a kind of flexibility, so you may shorten, you may prolong if the patient has high bleeding risk or high risk of ischemia. So it's really based on the individual profile of ischemia and bleeding. And if the patient has acute coronary symptoms, then the default duration is 12 months, but again here you can shorten if the patient is high bleeding risk. You may prolong if you want to protect the patient from an ischemic point of view.